An oral appliance, or better known also as a mandibular advancement device, is a second treatment option for sleep apnea, most commonly known as obstructive sleep apnea. Most patients who are unable to tolerate a CPAP or don't think that they can even try, the oral appliance is an option for those patients. The oral appliance is custom fit. It slightly brings your lower jaw forward. It opens up that airway so the patient has less apnea events where they quit breathing at night. It decreases their snoring. It allows them to have a better and more restful sleep, so the next day they are not as fatigued and not as tired throughout the day.
It's an alternative to the CPAP, and it's used to treat sleep apnea. There's a variety, there's probably 20 to 30 different types of oral appliances. The most common type of oral appliance is called a dorsal appliance. This particular appliance is a little two-piece appliance. It's got a top component and a bottom component. And what happens is the top component snaps on your top teeth, the bottom component snaps on your bottom teeth. And what it does is it holds your bottom jaw forward at night. And the reason that works is because someone with sleep apnea, again, whether they're lying on their stomach or their back or their side, what's happening is your tongue falls back in the back of your throat. So by holding your bottom jaw down and forward at night, it pulls your tongue out of the way, so therefore when you lie down, your tongue doesn't fall back in the back of your throat and you don't have these sleep apnea episodes. Oral appliances are highly effective in treating patients with mild to moderate sleep apnea and those that just can't tolerate the CPAP. The incidence of not being able to tolerate a CPAP is really high, and that's where the oral appliance comes in. Over 94% of patients that are given an oral appliance are still wearing it 6 months later. So that's the real benefit of this oral appliance. It doesn't matter how good treatment is, if you're not consistently wearing it every single night, that's the problem. A CPAP is by far the most common treatment for sleep apnea. It involves a mask and hose and some kind of air device that actually pumps air through the hose into the mask, and what it does is it blows this heavy stream of air down your throat, and depending on how severe your sleep apnea is, it'll be a situation where they can either increase the pressure or decrease the pressure. But what happens is it blows this heavy stream of air down your throat, and what it does, again, it pushes your tongue out of the way, opens up your airway, prevents you from having these episodes of sleep apnea. The difference between a CPAP and an oral appliance is that an oral appliance is a small little two-piece appliance. It fits comfortably in your mouth. It snaps on your top teeth and bottom teeth, and what it does is it holds your bottom jaw forward. By holding your bottom jaw forward, it does the same exact thing as a CPAP in that it opens up your airway and prevents you from having these sleep apnea episodes. The big difference is the fact that there's no mask, no hose. You can have whiskers or you can have a beard, and your appliance will still comfortably fit in your mouth. You can lie on your stomach or your back or your side. It makes absolutely no difference, and just overall, it's a far more comfortable alternative than a CPAP. We hear this hundreds of times a month. Patients come into our office, "Doc, I cannot tolerate my CPAP." They may not use those exact words, but they say, "I don't like the mask, I don't like the hoses, I don't like the air. I've tried multiple, one mask after another, can't find one that fits." Simply not being able to wear your CPAP every single night, consistently, night after night after night. That's the definition of not being able to tolerate a CPAP. Oral appliances are highly effective in treating sleep apnea, especially patients with mild to moderate sleep apnea. An oral appliance is just as effective, studies have shown, as compared to a CPAP. And it's specifically designed for, again, patients with mild sleep apnea, moderate sleep apnea, or especially for those who can't tolerate the CPAP. Only about 40% of patients that are given a CPAP are still wearing it 6 months later. whereas 94% of patients in our practice that are given an oral appliance are still wearing it 6 months later. That's the big difference between a CPAP and an oral appliance.